Okay, looking on the inside of the atria, here you can see the pectinate muscle. There's that smooth surface for the crista terminalis. Right here you can see the 3 entry points, which are in a darker color, and so the inferior vena cava, superior vena cava, and coronary sinus. You can see a little bit of a depression, which is where you have your fossa ovalis. And in terms of conduction, you have the, not very well pointed out, but you have the AV valve and the, AV node and SA node. So the SA node is this faint area there, and then the AV node is that faint area there, and that's supposed to conduct into the rest of conduction system, which this doesn't show it. So don't emphasize conduction system in this heart. Right here you have your valve, and this should be bicuspid. So, tricuspid, sorry. 3 cusps, 1, 2, 3. So there's your tricuspid or your right atrioventricular. And then as we go into the right ventricle, you can see the cusp and the chordae tendineae, and the chordae tendineae attached to the papillary muscles. And here you see the trabeculae carneae. This valve here is the pulmonary semilunar, and so that leads into the pulmonary trunk. And as we look over on this side, we have a view of the left atrium. So this top portion is the left atrium, and so is this in here. And so in here, if you can see closely, you can see the atrioventricular septum, and on the other side is where the opening used to be for the foramen. Okay. So here you see the bicuspid valve, and if we look at it from this view, you can see that there's only 2 cusps. There's the chordae tendineae and the papillary muscle. So on this side, chordae tendineae and papillary muscle. This is the trabeculae carneae. And the other thing that you can see here is the layers of the wall. So this would be the epicardium, myocardium, and then the inner lining is the endocardium. This is the aortic semilunar valve, so this is curving and going this way to where the aorta is. The other thing that's different that this heart has that the others don't is this view here, so you can see where the azygos connects in the back of the superior vena cava, and you can see more of the curvature for the aorta. Up here, this is the esophagus, and this is the trachea. So this would be all part of the metastatum. That's it.